You all, and I am delighted that I get to follow that very substantive panel with two panelists that are going to continue the conversation. Tony Elumelu is the founder of a foundation that works in Africa and does an amazing climate health related work. Theresa Ribera, the third Deputy Prime Minister of Spain, is also the Minister for Ecological Transition and Demographic Challenge. Would you welcome both of them to the stage? Thanks. Please. We are thrilled to have the day today really devoted to health. And I want to thank the United Nations Framework, CCC, for having a day committed to health, to gender, to food and agriculture. It's incredibly important that we emphasize these issues, their relationship with climate change, and most importantly, looking for solutions from the public, private, not-for-profit, philanthropic sectors. So I'm going to get right into it because the Clinton Global Initiative, as many of you know, or I hope will know, has been working in the area of climate, women, and health for many years, bringing partners together to try to find solutions based on commitments to action that groups make that will make a difference, but also get to scale. And over the life of the Clinton Global Initiative, we have had commitments and the actions taken pursuant to those commitments that have affected over 500 million people's lives directly. But we're always trying to figure out ways that we can go further and include more people and have lasting change that is not going to be upset or reversed. So, Theresa, let me start with you. You have been a leader in the climate, environmental, ecological space for a long time. You've attended other COPs. How do you feel that this is the first time we've had a targeted focus on climate change's impact on health?
Probably I leave it. Sorry. Yeah. Next time will be climate change and electronics. No, thank you. Thank you so much. And I think that, as you are saying, Madam Secretary, this is very important. It is very important because we need to show, to commit, and to engage to the fact that climate change also means a threat to health. Sometimes people, when thinking about climate change, they figures out that there are researchers, scientists, people looking to the clouds. And it is very difficult to connect to an average citizen of the world saying that climate change impacts on access to fresh water, on access to health, on access to food security. So it's important to show why these are items that are connected and how we can anticipate and lower the risk on the people's health, people's integrity connected to climate change. They have been commenting in the roundtable being moderated by Chelsea Clinton on the different aspects that are evidence on the cardiovascular and breathing disease connected to the changes in the temperature, in the dust in the air, the quality of the air. But I think that there are many other aspects that are slightly identified that deserve further attention. So having the research community and the health community working together with climate community is very important to learn more, to do more, and to communicate better so that we understand that this is a win-win option that we need to build.
I agree with that completely, and I also think it's important to connect the impact on health in a very direct way because we're still finding people who are not certain about what climate change actually means and whether or not it is affecting them, and linking it to disease, whether it's respiratory, cardiovascular, infectious, whatever it might be, and then linking it directly to a climate-related problem like heat, I think does begin to connect the dots for a lot of people. You know, Tony, you have, through your foundation, been working to empower a new generation of entrepreneurs across all 54 countries in Africa. And that has historically meant focusing on economic growth, economic security, jobs, incomes, but health has captured your attention. And why has the impact that climate change is having on health done that for you?
Sir Clinton, let me congratulate you and the Clinton Global Initiative for this platform. Well done. The humanitarian work you guys do, developmental work, has inspired many of us, especially in the Global South. So well done. You don't know the impact you guys are creating. I, as an African, I see firsthand, right from my youth, the linkage between climate, health, and environment. I come from the Niger Delta part of Africa, Nigeria precisely, and growing up and to date, I've seen how environmental degradation, environmental tragedy leads to human and health tragedy. And I said to myself, when my wife and I in 2010 created the Tony Elumelu Foundation, again, inspired by what you have done, that we must do it in a catalytic fashion. We must do it in a manner that helps Africa to develop. We come from the school of thought that no one but us will develop Africa, and we believe that we Africans must come forward so that others can even support us. We know where and where the shoe pinches and how it feels. And so, and my wife also is a medical doctor, and talking about the interest in healthcare. We decided, seeing these young Africans that we have supported over the years, how energetic they are, how excited they are to contribute their own quota in helping to change and improve lives on the continent. And that is a major reason we decided to prioritize healthcare. We see the devastating impact of climate change on the continent. We see how it's actually depriving people. We see floods, we see famine. We see desertification. We see how all of this, in fact, just on the 30th, just 3 days ago, the World Health Organization published a report where it stated that malaria, the prevalence of malaria is increasing further. Malaria, because of the changing temperatures, because of the harsh weather conditions, malaria control has become almost more difficult now than ever before. And we cannot talk about economic development of the continent of Africa without fixing the health sector. The healthcare sector has been very, very left behind. And that is why when we see global development institutions, platforms like yours, prioritizing and supporting healthcare delivery, we think that is one of the most critical factors we need to fix to develop Africa. That is the interest of our foundation.
Well, you have, and I know your wife has influenced you on this, but you have understood the importance before a lot of other foundations. Foundations that work on health didn't connect that with climate. Foundations that worked on climate did not connect that with health. So you have been a real pioneer in this. And we're hoping that coming out of this event and out of COP in general, you know, we can work to connect that with more philanthropies because it is an opportunity now that we have to take. You know, Theresa, I know you've been working for a long time, and congratulations on the news from last October that the European Council and Parliament reached an important agreement enabling the adoption of renewable energy. Now, many of us assumed that Europe was much further ahead than us, but you needed to have this agreement with all of the EU nations to really think bigger in how you could implement this. But it does bring you closer to the goal of climate neutrality by 2050. Can you talk a little bit about how you see the trajectory of change in Europe, and why is that crucial to our health and well-being? I mean, Tony's just talked about, the need to really deal with health in order for the people of Africa to have more and more opportunities. We think obviously of Europe. Well, what does that mean? But we know that this year, 61,000 people died from heat in Europe. 61,000 people. And this is going to be a problem throughout the world. It's not just in places we think of as historically warm that are getting hotter. This is a problem everywhere. And so tell us a little bit about the linkages here.
This is a very important issue, and it helps to connect dots, which is true. This last summer we had days with 47 degrees next to the coast in Spain, in the Mediterranean area, where normally you don't go beyond 30 degrees in summer. So it was the temperature of the Arab United Emirates, but happening in Valencia. And it's true, 2,000 people died because of the heat waves, because of the heat temperature, because of tropical temperatures during the night. So people not being able to refresh, which is good, which is needed in our bodies. And it's true that this comes back to where the problem is originated, and it is connected to climate change. Because of course, the change in the temperature parameters does come because of the higher concentration of CO2 equivalent in the air, and it creates these additional tensions with new vectors for new infections and new diseases, but also in terms of physical capacity to resist to these impacts. So, yes, we need to change the energy systems, which is not easy. That's for sure, because it is a system. So it's not just changing a plant that produces electricity by a new type of plant. It's much more systemic, and we need to do many things. But it is also thrilling and fantastic. We have the capacities to change this. We have tested, we have proven that it works. We have proven that it provides more affordable, secure, and stable sources of energy that do create less problems in the quality of the air we breathe. So we need to connect all these elements, and we need to be audacious on this. And I am very proud to see how yesterday we had very good news in the plenary, where this pledging of multiplying by 3 the renewable energy being installed from now up to 2030 worldwide, and a huge improvement in energy efficiency also shows how we can build things together in a different manner, with many other things to be worked around. But this means also innovation, work for youth, solutions that can be scalable and can also be built for small, isolated communities to ensure modern energy accessible for all. So I think that we need to make things happen, and it is our responsibility to send the signals, to have everybody on track and using their engines, their mind engines, the gray material to think on solutions.
I like the comparison about what can be done to make your systems in Europe more efficient, working regionally, not just nation by nation, and really drive the kind of efficiencies and transition that is necessary. And I think making the health arguments gives us an additional way of trying to communicate both to citizens and to leaders. But in Africa, as you know so well, Tony, we still have energy poverty. We don't have energy systems that are going to be transitioned. We've got to create systems and support the necessary build-out infrastructure and hopefully leapfrog from fossil fuels into renewables. But it's a real dilemma for the continent. You're experiencing a major baby boom. The median age on the continent is 19. The population is projected to nearly double in the next 25 years. And in the same period, we've got to figure out how you're going to create jobs, how you're going to educate this next generation of Africans to succeed and thrive, and at the same time, do it in a way that doesn't exacerbate climate change and the effects, which are, health-related inequities and everything else. So, as a successful businessman, before you were a philanthropist of such note, Tony, how do you see driving the climate agenda, the health-related agenda, and job creation all at the same time?
No, Sir Clinton.
A simple question.
Loaded question. But joblessness is a betrayal of young ones in Africa. And indeed, you don't even see the solution, which is one of the things we try to do with the Tony Elumelu Foundation and also the coalition we're putting together so that, and as you said, we'll come back to Clinton Global Initiative to see how we can all collaborate efforts to help and make the world a better place. Youth joblessness is a major issue on the continent and is growing. And we see every day the disastrous impact of this climate change. It's affecting people in Africa and creating, even worsening the joblessness on the continent. Access to electricity is extremely poor. I mean, less than about 60% of Africans don't have access to electricity. It's that bad. And so when we talk of the development of the continent, the transformation of Africa in the 21st century, where do we begin from? Where do we really start from? Spain is just about 14 kilometers away from Africa. And talking about joblessness, every day we see, we read, we hear about the problem of emigration of young ones from Africa to Europe under very harsh conditions. And why do they do this? Because they are driven by poverty, they are driven by joblessness, and they are driven by the fact that there's no hope for tomorrow. So they rather die crossing the Mediterranean than sitting back on the continent and having no access to electricity, having no jobs, and being afflicted by the lack of healthcare delivery. So it's a major issue. I believe that it's almost like the Marshall Aid here. We need to all collaboratively work together, development agencies, government, great partners like the Clinton Global Initiative, and successful private sector, global private sector, to see how we can improve access to electricity, in spite of that we know there are global climate challenges, but how do we, Africa is blessed with so many, like sunlight, etc. How can we combat some of these? How can we embrace renewable energy? How can we create jobs for our people? How can we improve the economic and human conditions on the continent? And how do we make access to healthcare delivery affordable and available to people? So it's a major issue, and one I believe that should be on the table as we talk about the climate impact.
I wish, if I could wave a magic wand, that coming out of this conversation, there would be a follow-up discussion between both European countries and maybe the EU, plus African countries, businesses, and philanthropists. Because I believe one of the models that is worth trying is to create employment in Africa for these young people. When we think about the costs, and not just economic costs, political costs, social costs of migration, on both the migrants' part, who is desperate to move forward, and on the societies that they are trying to get into, which creates all kinds of challenges. I just wish we could get more creative. And we could be perhaps then in a position in Europe to say, no, we are truly committed to helping to create employment in Africa, and we have committed to these zones. I don't know, I'm just making this up, but some kind of like opportunity zones, employment zones, whatever. And we are going to take tough positions on migration because people don't want to leave their countries, their families, their heritage. But if you're desperate enough, and I have these conversations all the time with people who are very upset about immigration in our own country, and I say, put yourself in the position of these people. I know you are an ambitious person. You are a hardworking person. you care about your family, and if you thought the only way to get ahead and care for your family was to migrate, you would. So think about what's going through the heads of these young people, because it's often the most ambitious, the most willing to uproot and move. So, and I think, and I talk for my own country and every other country that is receiving migrants, let's think creatively, especially at the time of climate, dislocation. Let's think creatively about doing something to really make big investments. And I think it would be politically, smart to do that. But, hopefully, maybe we can follow up on that. And that leads me to natural disasters. And Theresa, you have been a strong voice and a leader for establishing early warning systems for natural disasters in every country by 2027. What would be the benefits to our health, because we want to focus on this for this day here, of installing these systems, and what solutions are the Observatory for Health and Climate Change uncovering when you think about implementing these systems in countries?
Thank you for the question, but I'm going to go back to your previous suggestion because I think it's very important.
And I will also.
We are a little bit... No, I think it is very important. And coming back to climate, I think that there is something that should be used as a greater opportunity to build differently, what we used to call co-development. We know that for this peaceful future that we want to build around renewable energy and so on, there will be a need of new materials. It's not the traditional raw materials connected to oil and gas. You also have oil and gas. But it is this long list of raw materials that are required and that are very frequent in Africa, in many countries of Latin America. And I think that it should not be young people working on mining full stop. I think that there is a great opportunity to build through training, through creating add value, industrial services and much more connected high value opportunities that should remain at home, and a much more balanced approach in trading. So I think that there are things that we need to explore differently. Because it's true that when we talk about the impact of climate change, everybody tends to think this is local impact. It's not true. The local impacts do have an impact beyond our borders, because flows of water, people desperate that do not have access to food. Of course, they go to other places or they miss traditional ways to access to those rivers or whatever. So I think that it is worth it to work in this 14 kilometers difference between Gibraltar and Africa. That's my comment. But yes, I think that we need the public health services used to be, I don't know, the small sister in any health system in our countries. And the pandemic, COVID, and climate, air quality related diseases are such a big proof on to what extent we need to invest much more in updating the way we learn at the medicine schools, the way we develop health policies to take into consideration all of this, the way we anticipate what it may mean and how we can anticipate what it may happen. So yes, the early warning systems are very important, and we should have in every single country these early warning systems. This is a proposal coming from the Secretary General of the United Nations, and I think that we need to push for that. It's so easy to count on that. And then to develop, but the primary response is not so difficult to be built, and it's something that deserves our attention. But the second thing is that yes, we need to learn a little bit more what are the relations between climate change and the health of the society and how effective our responses are. And this was why we decided to create this observatory on climate and health, to be able to learn, to have figures to improve the policy response, including, of course, the early warning systems. But I think that we know enough to do much more, but we still need to know much more, to be more effective in the response that it deserves.
Tony, do you want to add a comment?
Yes,
to?
I think you hit in there. This issue of joblessness has many implications. Europe in particular, the migration issue. And I believe that something should be catalyzed from this conversation. Our foundation will be willing to partner with the Clinton Global Initiative, and I'm sure governments also, Europe, etc. We did something recently with European Union, European Commission, where they brought $25 million, we might $25 million or so, and we're able to support over 5,000 young entrepreneurs in Africa this year. I will give each of them $5,000 non-refundable seed capital. We train them for 12 weeks. We appointed global mentors for them. All we want them to do is to embrace green economy, and more importantly, help to create jobs, employ people, create jobs, because ultimately, this is the way to help develop, and more importantly, to stem the migration, because it is, as Secretary Clinton said, a major issue. The people who are migrating and where they're going to. It's even bigger challenge there. So the earlier the world comes together, I would like us to really invest a lot in advocacy and resources to make the difference. So that's the comment I wanted to make.
Well, we will be following up with both of you, and now I think we were expecting Dr. Tedros. Is he here? What? Oh, he can't make it. Oh, well, I want to, just conclude this important session and the one that Chelsea moderated before by underscoring what is obvious to all of you here, because you're here. But we have to do a better job communicating this. And Theresa and I were talking backstage, and I have to admit, those of us who work on these issues, care about these issues, see the interconnectivity between climate and health and joblessness and inequality and all of the rest of it. We have not done a good enough job communicating that. And out of this COP in particular, since we are talking about issues that are definitely related to climate, but most people don't necessarily understand that or see that. How can we do a better job? And there's a lot of really talented people among the 110,000 registrants for this COP, which blew me away. There's a lot of really talented people, and we all have a stake in making the case better than maybe we have in the past. Negative messages are just so much easier. But I want to just end because these two people are so knowledgeable and so effective in what they've done. So I just want to give the last words to them. How can we do a better job, communicating, first of all, to people, but secondly, to leaders, what's at stake when it comes to our health? How would you do that, Theresa?
Well, that's also for the next workforce that we are going to organize, no? Yes.
We're putting it on the list here.
Putting it on the list. Now, I think that this is very important. And the reason why we move forward tends to be more effective when it is a positive reason than when it is a negative reason. That creates much more innovative approaches, audacity, and so on. So I think that it is very difficult to stick to, this is horrible and we have a problem. We need to go beyond that. And at the same time, I think that we need to pay attention from the roots, what the young people, what the small communities, how they see the problem, because this is the way to think in a much more strategic manner how we communicate up to the leadership why it matters. But it has to be simple, it has to be concentrated and credible, and according to my own understanding, it is better if it is positive.
Tony, last word.
Yes, thanks. I think, as they say, if you want to go far or fast, you go alone. If you want to go far, we go with people. For this to succeed, we need a coalition. We need a global coalition, North-South coalition. We need our women, our young ones, our private sector people, development agencies, and government, all of us coming together to propagate and let the world know, as we do see every day in our respective communities, that climate change is real. It has telling impact on health. It has significant impact on joblessness. It has huge impact on security. People who are deprived from their economic opportunities take to extremism. We have seen, I have seen it, it's happening in Africa, how extremism is being fueled by poverty, is being fueled by desertification. If you look at the Sahel region of Africa, they suffer the brunt of climate change the most, and insecurity is highest there. So there's a positive correlation. We need to come together. We need to come together so we can go far and be more impactful as the world. Thank you.
Well, I can't think of a better note to end on. Thank you both so very much, and thank you all for being here.